In March 2010, Congress passed and President Obama signed into law historic health care reform legislation, the Affordable Care Act. Millions of Americans are already benefiting from this law. Insurers are no longer allowed to discriminate against children and others who are sick. Small businesses are receiving billions of dollars in tax credits to provide health care coverage for their employees. And seniors are saving money on prescription drugs and receiving free preventive care through Medicare.
House Republicans will soon vote to repeal these important new benefits. In addition, the conservative Supreme Court may declare this important bill unconstitutional, which will increase health care costs for millions of Americans. This will cause many families to lose coverage and increasing the national debt by over $1 trillion. This analysis describes the impact of repeal of the Affordable Care Act in the 7th Congressional District of New Jersey. It is the congressional district of Leonard Lance. It finds that repeal of the health reform law would have significant consequences in the district by allowing insurance companies to deny coverage to 120,000 to 303,000 individuals, including 9,000 to 39,000 children with pre-existing conditions. Rescinding consumer protections for 508,000 individuals who have health insurance through their employer or the market for private insurance. Rescinding health care tax credits for up to 18,200 small businesses and 74,000 families. Increasing prescription drug costs for 8,100 seniors who hit the Part D drug donut hole, and denying new preventive care benefits to 96,000 seniors. Increasing the cost of early retiree coverage for up to 9,700 early retirees. Eliminating new health care coverage options for 1,700 uninsured young adults. Increasing the cost to hospitals of providing uncompensated care by $17 million annually. Repeal would eliminate the ban on discrimination on the basis of pre-existing conditions. Under the health reform law, insurance companies can no longer deny coverage to children with pre-existing conditions, and will be banned from discriminating against adults with pre-existing conditions by 2014. There are 120,000 to 303,000 residents in Representative Lance's district with pre-existing conditions like diabetes, heart disease, or cancer, including 9,000 to 39,000 children. Repeal would allow insurance companies to refuse to insure these individuals if they seek coverage in the individual or small group markets. The consequences would be particularly acute for 10,000 to 24,000 individuals in the district who currently lack insurance coverage and who would be unable to purchase individual policies if the law is repealed. Repeal would eliminate the ban on annual and lifetime limits. If this protection is repealed, insurers would be able to impose coverage limits on 508,000 individuals in the district with employer or private coverage. This would be a disaster. Repeal would eliminate the ban on rescissions. Repeal would allow insurance companies to resume the practice of rescinding coverage for the 27,000 district residents who purchase individual health insurance. Repeal would eliminate the requirement that insurance companies provide free preventive care. Repeal would allow insurance companies to charge for these essential benefits, which would increase out-of-pocket costs for 107,000 district residents. Repeal would eliminate health insurance options for young adults. The health reform law allows young adults to remain on their parents' insurance policies up to the age of 26. In Representative Lance's district, 1,700 young adults have or are expected to take advantage of this benefit. Repeal would force these young adults to find other coverage or return to the ranks of the uninsured. Repeal would eliminate tax credits for buying health insurance. Starting in 2014, the health reform law gives middle-class families the largest tax cut for health care in history, providing tax credits to buy coverage for families with incomes up to $88,000 for a family of 4. Repeal would deny these credits to 74,000 families in the district. Repeal would increase drug costs for seniors. Repeal would increase the average cost of prescription drugs for these Medicare beneficiaries by over $500 in 2011 and by over $3,000 in 2020. Repeal would deny seniors new preventive care and other benefits. The health reform law improves Medicare by providing free preventive and wellness care, improving primary and coordinated care, and enhancing nursing home care. The law also strengthens the Medicare Trust Fund, extending its solvency from 2017 to 2029. Repeal would eliminate these benefits for 96,000 Medicare beneficiaries in the district and cause the Medicare Trust Fund to become insolvent in just 6 years. Repeal would eliminate tax credits for small businesses. There are up to 18,200 small businesses in Representative Lance's district that are eligible for this tax credit. The health reform law provides tax credits to small businesses worth up to 35% of the cost of providing health insurance. There are up to 18,200 small businesses in Representative Lance's district that are eligible for this tax credit. Repeal would force these small businesses to drop coverage altogether or bear the full cost of coverage themselves. Repeal would increase the cost of uncompensated care borne by hospitals. The health care reform law benefits hospitals by covering more Americans and thereby reducing the cost of providing care to the uninsured. Repeal would undo this benefit, increasing the cost of uncompensated care by $17 million annually for hospitals in the district. Nationally, repeal would increase the long-term debt by over $1 trillion. The health reform law reduces the nation's debt by eliminating waste, fraud, and abuse in the healthcare system. It would do this by reducing the growth of healthcare costs and preventing excessive profit-taking by private insurers. According to the Congressional Budget Office, the bill will reduce the deficit by over $200 billion over the next 10 years, and by over $1 trillion in the decade after that. Repeal would eliminate these cost-cutting measures, adding more than $3,000 to the national debt for each American, including the 660,000 residents of the district. For the 7th Congressional District in New Jersey, repeal of Obamacare would be a total disaster for its residents. And keep in mind, this evaluation only covers one congressional district. Repeal of Obamacare would be an absolute disaster. This analysis is based on the following resources: